Just to look at some of the symptoms in a bit more detail, this looks at respiratory symptoms at enrolment. So I'll just pick one of these. Orthopnea. Orthopnea is breathlessness when lying flat. So of the 338 patients globally who were assessed, 112 had this particular symptom, so 33%. And of the 41 UK patients, 7 of them had this symptom, 17%. Okay. And we can explore different some of the respiratory symptoms in more detail. What about musculoskeletal symptoms at enrolment? I'll pick one or two of these. You know, I did try and make these things at a diagonal, but I couldn't quite work out how to do it. So I'm having to. If you look at this one, which is frequent falls, this lighter blue is globally, and this darker blue is UK. So 80 is that 84? Yeah, 84 individuals globally, about 25% had frequent falls at enrolment, and in the UK, 11 patients, which was about the same, 26-27%, also had frequent falls. And we also look at things like users ambulation device, using a cane, using a walker, unable to run. So we can build up a nice picture in a lot of detail what the musculoskeletal and functional symptomatology is. What about pulmonary function, respiratory function? I'm sure many of you may have had these respiratory function tests. You take a deep breath and you blow into a mask, and the computer captures various parameters relating to the strength of your chest wall. If we look at this particular value, which is FEV1, forced expiratory volume in 1 second, so it's how much air you can breathe out in 1 second. Okay, so it's a measure that respiratory physicians look at across a number of different diseases: asthma, chronic obstructive airways disease, and of course Pompe. In the global group, 139 patients, the mean FEV1, how much air was blown out in 1 second, is 2 litres, which is, if you look at the predicted normal, it's 60% of the predicted normal. It's about half the functioning. The UK, 29 patients, the mean was 1.7 litres, which is 56% of the normal value. Okay. So by collating these measures, once again, we can build up a nice picture of what the respiratory functioning of individuals is. Okay, any comments on that? That was focused on the juvenile and the adult onset form. No? I have a few slides of data looking at infantile onset that also may be of interest. This is demographic information. You can look at birth weight, birth length, although no one in the UK seems to collect that. And then age at symptom onset. So, for example, of the 89 patients globally, the mean age of symptom onset was 2.9 months. In the UK, 1.5 months. What about signs and symptoms in infantile onset disease? If we look at this particular parameter, which is developmental delay, this is a delay in the normal milestones of a child to sit or to be able to turn over or to crawl. And we see that if you look at the global group of patients, 58 patients, about half of them, had some delay in their progression of milestones. And in the UK, there were 4 patients who were assessed. About 40% had a delay in the progression of their milestones. Other symptoms, we can look at things like hepatomegaly, for example, which is an enlarged liver. 50% globally, 70% in the UK have an enlarged liver. So once again, building up a nice picture of various symptoms across different systems. And once again, musculoskeletal systems. symptoms, sorry. Okay, so I've shared a little bit of the baseline UK data. So what I mean by baseline data is the data when patients are enrolled into the registry. Hopefully next year, the year after, we'll have data of individuals who've been on treatment for a year, and we may be able to see how some of these parameters change over time. So what kinds of activities are happening with the registry? Well, we have responsibilities to the FDA, Health Canada, EMEA to give them reports on a regular basis. All of the majority of patients who are on trials, these are our different code numbers for the various trials, the data that we collected in the trials are being input into the registry, so we're building up a longer-term picture. The IT platforms constantly need to be updated and upgraded simply because IT technology is changing very rapidly and we're handling larger and larger amounts of data. We've started developing an annual report, so every year doctors and nurses that treat Pompe will be given an annual report on the Pompe registry. We have that in draft. It's not actually, I don't believe it's, I've not seen a hard copy yet. We have advisory boards, so these are the groups of specialists from around the world who get together and talk about the data and talk about what kinds of publications they'd like to develop from the data, so they're being set up. And also we're trying to ensure that the quality of the information that goes into the registry is as high as possible. You know, part of the value of a registry program is not just to be a big, a storehouse, a repository of information, but it's to help develop this international community of treating specialists who can get together on a regular basis and work out how best to treat and manage conditions such as Pompe. They're a resource for regulatory and national health authority reporting. Obviously, we get to understand longitudinal data and characterization of the disease. And hopefully we'll be developing some scientific publications from these and presenting information and influencing the development of guidelines. So we're still learning about many aspects of conditions such as Pompe. And from a Genzyme perspective, we feel that these therapies that we develop, they carry they're a global lifelong responsibility. And registry is an essential part of understanding and managing this responsibility. The registry is a key part of our evolving understanding. But it doesn't work unless we have the involvement of patients and families. It's with your consent to allow the data to be collected and your ability to help us complete some of the questionnaires that really makes this a valuable database, a valuable tool. And it means that we would join this global community of individuals and help understand the disease better, signs, symptoms, and help improve treatment outcomes for all. So in conclusion, I think I'm pretty much running out of time, but we talked very briefly about home care, we talked very briefly about dried blood spot testing, which I think are going to be explored in more detail later on today. I briefly gave you an overview of what's happening at the World Muscle Society meeting and spent the bulk of the day talking about the Pompe Registry Programme. I'd hope to have more data on it this time next year. That's my email address. If you need to ask questions or you want to contact me, please feel free to note that down and send me an email. And if we have a couple of minutes for questions, I'll happily take them. So thank you very much.